Please welcome our final speaker this morning, Dr. Meg Sullivan, Counselor to the Secretary at the Department of Health and Human Services.
Hi, thanks for joining us.
Thank you for having me.
Okay, let's start with maybe a PSA of what people should do this fall.
Yeah, and so good morning, everyone. First, thank you for having me. I am Meg Sullivan. I'm a pediatrician by training, but currently work as a counselor to the Secretary, Javier Becerra, including covering COVID-19. And I'm really excited to have this opportunity. Although there was a moment where I was thinking I didn't need to be here because I felt like the other panelists were doing my job.
Good.
So yeah, my PSA is risk less, do more, which you already heard about. I think we are entering the fall respiratory season. Obviously this is a time where we know people get sick, we know people are hospitalized, and unfortunately we know people still die, but we also know we are so much more prepared at this time, and we have effective vaccines. So I think more than anything, everybody should be vaccinated, everybody should tell their loved ones to get vaccinated, and everybody should take all of the measures to protect themselves and their loved ones.
I know you described a little bit of what you do at HHS, but can you kind of expand a little bit day to day, what's your role, and maybe working with other agencies and educating the public, et cetera, et cetera?
Yeah, I think specifically, right, with COVID-19 and more broadly respiratory season, HHS obviously as the kind of federal agency that helps lead responses as well as make sure that the public has the information and tools it needs to protect itself and prepare for respiratory seasons. I work across a variety of agencies, whether it's the scientists at FDA and NIH, whether it's public health specialists at CDC and the Office of the Assistant Secretary for Health, whether it's actual providers through Indian Health Service who are on the ground providing it, whether it's through HRSA, who are working closely with our community health centers that we know are so fundamental to making sure that we are accessing rural areas and other places that don't necessarily always have access to healthcare. And I think, in the Secretary's office, our role is really to make sure that we have kind of a coordinated response, messages and tools that speak to people and reach people. But I think more than that, and one of the reasons that I'm here today is partnerships, right? The collaboration that is so necessary with our federal, state, and local partners. Without that, all of the work that we did would never kind of see where it needs to go on the ground. And so that's part of my role as well, is to help coordinate.
As a newsman, everyone has a story. You joined HHS in 2021, a historic time in health policy making. Can you describe the experiences that you went through? I'm sure it was intense, and what can we learn from that time period?
Yeah, I actually spent the very initial part of the COVID pandemic working as the medical director of a health department in North Carolina, and then, as you mentioned, joined HHS in December of 2021, just as Omicron was coming into our country. And at that time was working as the chief medical officer for the Administration for Strategic Preparedness and Response before I went to the Secretary's office. And I think the amount, I had seen from the ground just how much work was being done, but to see it firsthand and to experience just how difficult it was. In particular, ASPR at the time, we were still distributing vaccines, tests. This was when kind of COVIDtest.gov was just launched, but yet there weren't that many at-home tests. And so working to see how we could get them and get them into the homes of people. Therapeutics were just coming into being authorized by the FDA, and so working on supply and how we make sure that we do that as well. I can say, and I really do mean this honestly, the thing that struck me more than anything else was that equity was literally at the center of every single conversation. And again, we had millions of vaccines, millions of tests, soon to be millions of therapeutics as supply went up. But we recognized it was not just about distributing them, but really getting them to where they needed to be. And again, I will hesitate to sound like a broken record here, but without the partnerships that we formed to be able to do that, that would never have happened. But I think I'm really proud of the work that I've seen HHS and my colleagues do, but again, it was through that partnership and with that never-ending focus on equity.
Every speaker today has talked about the next question, but it's an important one. I want to ask you, how do you combat vaccine distrust and fatigue?
Yeah, I think it is such a hard question, but important question, right? Kind of as a pediatrician, I obviously have spent so much time talking with parents and patients about the importance of getting vaccines. And I think sometimes it is hard to be where we are right now, to see just the level of distrust and misinformation that is out there. I think, and I may echo a little bit of what I heard the previous panelists say, but I think the first thing is to be open to having those honest conversations and to recognize that there are valid reasons that people may have questions about the vaccine, whether it is something that they read, whether it is an experience, right, that they have had or that a loved one has had, whether it is just not having the right information. And so I think having those conversations and really trying to pinpoint for each person what it is that is making them question what the vaccine is. I do think the second thing, and and I heard this said before, but I think one of the things that we have been trying to work through, whether it's the CDC simplifying the respiratory season guidance or the HHS Risk Less, Do More campaign, to really go with those simple messages, and really try and get at what the heart of the matter is, right? Respiratory season is coming, vaccines are safe, vaccines are effective, vaccines save lives, let's do it. I think the third thing that we are really trying to do, and that the Risk Less, Do More campaign has been doing, is really doing focus groups on the ground with individuals with lived experiences, but also, importantly, healthcare providers and healthcare navigators and those that are actually out there, right, talking with individuals who may have those campaigns. And that's where a lot of these messages are being formed. They're continuing to do that research to inform, every step of the campaign that we'll see over as the season continues. And I think that's something that is really fundamental and going to hopefully make a big difference.
I've seen some figures that as far as the flu vaccine, it's right around 50% right now. Has COVID affected the flu vaccine as far as rates?
Has COVID affected, so maybe...
Meaning the concern about COVID that's out there lowered.
I see, you're talking about vaccine uptake.
Uptake.
Got
vaccine
it, okay.
Uptake, yeah.
I think that if we look at kind of pre-pandemic vaccination levels across the board to kind of where we are right now, whether it's a flu vaccine or others, I know we definitely have seen a bit of a drop. I think there's many things that we could point to. I think we've talked about vaccine misinformation, and a lot of that kind of came probably, even more prominent during the pandemic, which obviously would be influenced by COVID. So I don't think we can pinpoint one single thing,
okay.
But I think the most important thing, right, is to recognize where we are right now and what we need to do to hopefully get back to those levels that we've seen before.
And a lot of people, I remember about 10 years ago, I was too busy and I didn't get the flu vaccine update, and then I got the flu. And I learned from that lesson. I have a friend who 50 plus, didn't get the shingles vaccine. He's got shingles now. It's not a fun experience. Mm-hmm. But what are the most convincing arguments other than, oh, well, now I have it, I should have gotten it, but because not everyone's going to be in that camp.
Yeah, and I think we have been trying to, again, through this Risk Less, Do More campaign, try and pinpoint what those arguments are, right? And, really honing in on just a couple. I think the first is really about the level of risk, right? And I think, first of all, the campaign is tailored towards those that are at highest risk. And, when we're talking about COVID, obviously individuals over the age of 65, those that live in long-term care facilities, those with significant underlying conditions. But I think what's important to recognize is that nobody has a risk of zero. And so every single person, right, getting a vaccine decreases your risk even more, and I think just to recognize that. I think the second is, really that message around the protection of loved ones, and to recognize even if, again, you may not fall into a high-risk category, someone that you are around, that you may live with, that you spend time with does, and really the role of doing that. And I think third, it really is, just about, again, understanding kind of what the recommendations are, what the safety, data shows, and just that, again, risk less, do more, that really just getting that vaccine really allows you to do more fun things with your life that, we weren't able to do a couple of years ago.
What are other than the mistrust and misinformation that's out there, what are the biggest barriers to vaccinate specifically older Americans?
Yeah, I think that it's conversations that we are having every day about, right, we can have all of the vaccine supply that we need in this country, but if it is not where it needs to be, when it needs to be there, then that is a barrier. And so I think that is why, it is so important to make sure that vaccine is, kind of accessible around the country. But I think in particular the focus, and this is what the campaign is doing too, on long-term care facilities, recognizing the additional risk. And so I think that's something we have been working very closely with our long-term care partners. We have seen such incredible best practices and things that work, and thinking about how can we take those and apply those to other institutions. I think insurance coverage is another issue. I think making sure that everybody recognizes that, for Medicare now, that vaccines are fully covered. And so that people, when they do go get vaccinated, should have no, that are on Medicare should have no copay, and really trying to get that message out.
So cost is a major concern for people.
I think, for certain people, right?
Certain people,
I think,
course,
yes. So really working on that, working on access. And then again, I think it is thinking about, right, what would be reasons in particular when we're thinking about older adults that they may not get vaccinated, and as we think about our messages to tailor it there.
As I was talking to the congressman, we talked about the possibility of a shutdown during this time when we're talking about vaccines and the import of getting them. What would a shutdown do to this space?
Yeah, I think it's, as you know, vaccines are in the commercial market right now. And so, I know that's something that HHS worked hard to do and our partners worked hard to do. So in particular around vaccine access in the commercial market, well, it's hard to know what a shutdown would do with anything, right? But I don't know immediate. But I just think what more importantly, I think it's important to recognize just all of the important work that is happening, and hopefully that we can continue to do it without any delay.
What would you like to see Congress do moving forward to further these goals?
Yeah, I am also, I know you asked a question about a DC politician. I consider myself not that, but I will. I'm obviously always careful when I'm talking, but I do think that idea of, working together, I think we have done a lot over the last 4 years around pandemic preparedness, and I think I've often heard some of my colleagues say, the next pandemic is not if, but when. And so I think taking the lessons that we have learned over the last 4 years, the capacity and the tools that we have built, and making sure that kind of the government is resourced to not only continue those, but expand upon those, so that the next time we are faced in this situation, we are even more prepared than we are now. And even, fortunately right now, we are not in a pandemic situation, but to just make sure that we have the resources we need to be able to reach and help the people that we need to, including during this respiratory season.
A lot of people are getting COVID. I'm sure a lot of people in the audience, there's an uptick. Is that alarming to you, or is that just the way of the world right now?
Yeah, so I think we obviously were watching, we know particularly during August, the COVID, we saw a big increase in COVID infections. COVID rates do remain elevated in the country, although we are seeing generally a decrease. However, it is now September, we're going into October, November, December, and fully expect to see not only those rates potentially begin to increase, but also we have flu and RSV in the horizon as well. COVID is with us. I think it is endemic, just as flu and RSV are. So, I think alarming may not be the right word, but I think acknowledging it and being prepared for it. And again, at the risk of sounding like a broken record, let's use the tools that we have, Let's get vaccinated. People are sick. We have effective treatment, so let's use tests, Test early, access treatment. And I think that if we really do those things, then it becomes a lot less alarming.
I wanted to pick your brain a little bit just on the effect of COVID, because America is very focused on America, but the pandemic was global. And it's interesting to see different pockets of the world doing differently. And it was just, and I think to the defense of public health officials, this was something that we haven't seen in 100 years. It was weird, as some people were asymptomatic. Obviously, a lot of people died. So this was not easy to get a handle on, especially when China's not giving the world information. But looking, what have you learned from the global effect, and are we going to be learning a lot over the next maybe 5 to 10 years? Because there's still questions we don't know.
Yeah, so I think first of all, and I think we've seen pandemics and infections in the past that have been global, but I think COVID just highlighted, we live in a global society. And so, I think our pandemic preparedness, for example, cannot just be focused on domestic, but needs to be focused on global preparedness. And that is a lot of work and focus that HHS has done. I think that those strong partnerships around the world are so incredibly important. We do have employees of HHS that are constantly, whether stationed around the world or working around the world, I think is incredibly important. I do think learning from each other. I saw a lot of that during my time here at HHS, Particularly, as we were still rapidly evolving information, and we were looking at some of our partners around around the world who maybe saw some of the new strain peaks earlier and what they were learning in terms of vaccine effectiveness or testing. And so I think all of those lessons learned are things that we have to continue to apply and make sure is a focus as we continue to focus on pandemic preparedness.
You mentioned, and we talked about a lot today, aging society, the import for older Americans to get vaccinations, especially as a country, we're aging. What keeps you up at night, and kind of a closing, what do you want people to remember from what you want to say today? And the one thing, I always say with one article, our reporters, if they remember one thing from your story, that's a great thing. What's the one thing you want people to remember?
Yeah, well, so there's a lot of things that keep me up at night, so I won't answer that question. But, you know, this is going to sound cliche, but I think the reason I am here, right, is to say the one thing is everybody should get vaccinated, should tell their loved ones to get vaccinated, they should encourage others, they should, you know, I will just give again a plug for our Risk Less, Do More campaign. The website, risklessdomore.hhs.gov, has so much information. There's also a contact us place where if individuals are interested in reaching out and partnering and learning more. I think, you know, we have a fall respiratory season coming, and we have the tools to help minimize the impact that we will have for ourselves and our loved ones. And I think the thing to remember is we just need to take advantage of those tools.
I think that's good advice. There's been a lot of good advice today. Please thank Dr. Sullivan for joining us.
Thank you.
Thank you so much.
Thank you.
I'll hand it over to Joe.
Thank you, Dr. Sullivan and Bob. I'd like to just thank all of our amazing speakers today. I feel like I should have one sleeve rolled up at the end of this. I'd also like to thank our sponsor, ASCP, as well as support from Pfizer. I'd like to thank all of you for coming. If you missed any portion of this, you can find the whole video and background at The Hill. Stay well, and thank you again.